Yeah, okay. We'll go a little bit slow, don't worry. So today we are dealing neurology topics. Right. So in the neurology, the main things they are, wait, let me see whether it's getting recorded. Yeah, recording. Okay. So in the neurology, the main things they're asking is, one is how do you manage what is called as neurotoxic snake bite? Right. And second question they asked about is how do you manage Guillain-Barré syndrome? And third they're asking what is called as stroke unit. And fourth they're asking is what is the protocol in stroke management, stroke protocol. And fifth they're asking is how do you elicit some plantar response? What are the different responses you use in plantar? So what is the different methods of eliciting plantar? So all these questions are the neurology questions in April 2023 paper. We'll do one by one. So while doing this neurotoxic snake bite, I just want to let you know, not only neurotoxic snake bite, one paper they're asking neurotoxic snake bite, other paper they're asking about vascular toxic snake bite, in other paper they're asking about what is a pathophysiological snake bite. So complete snake bite as a topic I will cover today, right? So let us start with the topics. Are you okay, ready? Right. So let us start with the topic. The first topic today we are dealing is snake bite. So how many of you people have managed the snake bite in your hospitals? I think many of you have seen from the first year itself. You'll know what snake bites and all, how the people are coming with the snake bite, what are the different manifestations of snake bite, and what are the different types of snakes and all. But the only thing is, like, it was not mentioned in the Harrison, it was not given in the Harrison. So different protocols are saying different things, and all the protocols clubbing together. Today I'm telling you the class of snake bite, right? So snake bite, some basic introduction points. The main thing is what I'm following is actually WHO guidelines and also Ministry of Health and Family Welfare guidelines, right? Okay. So the snake bite is very burden because the most common cause of death in the case of rural areas is snake bite only. In the snake bite, that actually 50,000 per year are the snake bites, burden of the snake bite. So WHO has come up with a policy to decrease it to half by 2030. That is the main policy. Okay, by 2030, the deaths related to snake bite should be decreased to half. That is the main policy of WHO, right? So what is the point? What is all going on? We'll see. Let us see what are the different types of snakes. First, let us identify what are the different types of the snakes. So snakes identification. Right. So if you see snake bites and all, so first you have to know what are the different types of snakes, because different types of snakes has different manifestations are there. So if you see clinically, there are two families of the snakes which are very important. One is your Elapidae. This is your Elapidae, and this is your Viperidae. So two families of the snakes are very important clinically. One is Elapidae, another is Viperidae. So in the Elapidae, we have two types. One is your crate. So in the Elapidae, you have two types of snakes. One is called as cobra snake. Other is your crate. Right? And in the Viperidae, you have again two snakes. One is called as Russell's viper. Another is called as saw-scale viper. Clear? Right. So we'll see one by one. So first of all, how to identify the snake. Why it is important is in rural areas like some many tribal areas and all, whenever there is snake bite, people are very much educated. Like they just take the picture of the snake and will come to hospital and they'll show you the snake picture, or they'll just kill the snake and bring the snake to the hospital and they'll show you the snake. So you are in a position to identify which type of snake it is, because by identification only you will come to know this is this type of snake, this type cobra snake, this is crate snake, this is Russell's viper snake. So because of the different snakes has different manifestations, so that you can treat accordingly, right? Let us see how are we identifying the snake. So when you see the cobra snake, so cobra is a typical snake. It has only important thing, it has a very hood. This is the main hood. The thing, it has a hood is present, and along the hood there is a V-shaped mark is there, like this. There is a V-shaped mark present on the dorsum of the snake. So snake will be like this, just it has a hood every time. So when you see the hood on the dorsum, this is what is called as ventral aspect. This is the dorsal aspect. In the dorsal aspect, you will see V-shaped fang marks. So that is the identification of the cobra snake, right? And the crate snake, when you see, so crate is always black colored snake with white stripes. So if someone brings the snake, which is a black color snake and also white stripes are there, it is a crate snake, right? Right. So when you see the Russell's viper, so this viper V for viper, it's always has a triangular head. Okay, all viperidae, Russell's viper or a saw-scale viper, they have triangular head. So triangular head with 3 columns of scales, that is a Russell's viper, or a triangular head with no scales, that is your saw-scale viper, right? So what I am saying is, so clinically you have 2 groups of snakes are important. One is your Elapidae, other is Viperidae. In the Elapidae you have 2 snakes are there. One is your cobra and crate. In Viperidae you have Russell's viper and saw-scale viper. The first thing is how to identify the snake. Each snake has different morphological features, and each snake has different manifestations. So you have to identify the snake initially. The first thing is cobra. It has a hood. In the hood on the dorsal aspect you have a V-shaped mark is present, right? In the crate it's always a black color snake with white marks are there, right? In the Viperidae, V for V triangle, and all the Viperidae have triangular head. In the triangular head, if the body is having the scales are there, that is called as Russell's viper. If the body has no scales, it is called as saw-scale viper. Clear? Right. So I will send all the images in the group again. So just I am saying you for the identification easy points. After this, I will send you in the group the images of the snakes by which you can identify the snakes. Right. So after knowing this, so why this snake is very important? What is the problem when he is injecting a toxin or venom into the body? So what are the pathophysiological mechanisms happening into the body? We have to know, right? So what is the pathophysiology of? So we are dealing. What is the pathophysiology of snake bite? So for this you have to know what is called as dry bite and what is called as wet bite. So dry bite means there is actually the bite of the snake, there is fang marks on the body, but there is no venom entered into the body. That is called as dry bite. So there is no venom. So this type of speed is enough. Are you able to understand? Right. So dry bite means there is only bite of the snake is there. There is no venom entered into the body. That is called as dry bite. So it is nothing problem. There is only just local site pain is there. There is no venom inside of the body. So there is no toxic manifestations in the body. Right. Most of the 2 to 50% of the snake bites are dry bites. Right. So there is no issues. Right. But the problem is with the wet bite. So wet bite means venom has entered in the body. That is the problem. Right. So in the dry bite, only dry bite of the snake is there. Only fang marks are there from the body. There is no venom in the body. So most of the 50% of snakes are dry bites. There is no problem. But wet bites are, they are actually venom entered into the body. Now the toxic effects of venom will happen to the body. So now what are the toxic effects of the venom? We'll see. Right? Now, if wet bite is there, what is the problem? We'll see. The wet bite, venom is present in the body. So now what is the problem? Whenever the venom enters into the body, this venom has so many toxic elements, so many enzymes, and all these enzymes, they cause toxic effects on different systems of the body. They cause toxic effects on your skin, they cause toxic effects on your kidney, they cause toxic effects on your nerves, they cause toxic effects on your vessels. So all these things are there. So main things they're doing is they will cause first cytotoxicity. So wherever the venom got injected, in that part it will cause cytotoxicity. And they also cause what is called as vasculotoxicity. Okay. And then they cause neurotoxicity. Right. And they cause what is called as nephrotoxicity. And then cause what is called as myotoxicity. So the venom once entered into the body, it will affect different systems in the body. One, it causes cytotoxicity, neurotoxicity, nephrotoxicity, myotoxicity, and also vascular toxicity. So what all happened to the body, we will see one by one. So first of all, if we see what is called cytotoxicity, we will see once. So whenever the venom is injected into the body, right, this venom has multiple enzymes. So just remember by the mnemonic HCM, like MHC. So all these enzymes are, one is metalloproteinase, hyaluronidase, collagenase, and others are proteinase, phospholipase. So these are the enzymes present in the venom. So whenever these enzymes are there, what is going to happen? And all these enzymes, So all these engines, what are they going to do? They cause first thing tissue destruction. Right? For example, if venom is injected into the leg part of the body, in the leg the snake has bitten, the venom has entered there, it has all these enzymes, hyaluronidase, metalloproteinase, all these things, they cause what is called as tissue destruction. Once the tissue is destructed, what are the matrix is there, and the collagen, everything is destructed, and the venom is spreading into the body step by step, from the ankle to the knee to the hip, venom is spreading. So first is tissue destruction, right? And second thing, what is it doing is, it also called as vessel damage, micro vessel damage. So all these engines, what are they doing? One is called as tissue destruction, and other is called microvessel damage. Whenever the microvessel is damaged, all the endothelium is damaged. So endothelium damage, and what is called as, it will lead to capillary leak, and what is called as edema will develop. Capillary leak and edema will develop, right? And finally, what it will do is, finally lead to skeletal muscle necrosis, and also skin necrosis, what is called as dermonecrosis and myonecrosis, right? So what is cytotoxicity? Whenever the venom is injected into one part of the body, venom has a multiple enzymes, and all these enzymes like metalloproteinase, hyaluronidase, collagenase, proteinase, and phospholipase, they cause one tissue destruction. The local tissue, they will cause destruction, and because of that, venom is spreading to the upper parts of the body, right? After, it also causes microvessel damage, so endothelial damage that leads to what is called capillary leakage, so in local site edema will be developed, right? And then skeletal muscle damage, and also skin necrosis also happen, myonecrosis and dermonecrosis. So all these things will happen as cytotoxicity, right? So the important thing in this thing is, whenever there is cytotoxicity, for example, a patient has come to you with when snake has bitten and there is swelling of the leg and all, so what to do? The thing is like, first of all, you have to there's nothing severe pain, you have to give painkillers only. One important thing is, you should not give any antibiotics. There is no role of antibiotics. There is no role of antibiotics, right? And second thing is, there is no role of any fasciotomy. So when you have to do fasciotomy or antibiotics is only when there is necrosis. Only when necrosis is present, you have to give antibiotics, or you can do fasciotomy, right? So this is all you know about cytotoxicity. So the cytotoxicity, there are multiple enzymes are there. All these enzymes leading to what? Tissue destruction, and also cause microvessel damage, leading to edema, finally leading to skeletal muscle necrosis, and also skin necrosis. So whenever this type of patient comes to you, so there is no role of any antibiotics, there is no role of any doing fasciotomy. The only thing you have to do is, whenever there is necrosis, then only there is role of antibiotics or fasciotomy, right? Right. So after this, we are moving to one more next toxicity called vascular toxicity. So what is this vascular toxicity? Also called as hemotoxicity. Hemotoxicity. So what it's doing is, the snake venom, it contains so many toxins that is causing disturbance to your blood vessel and bone marrow system also. So what is it causing mainly? It's causing three things. One is thrombocytopenia. Okay, it causes destruction of the platelets, or what is called as altered platelet function. It also causes what is called as altered platelet function. Okay, or it will cause what is called as conjunctive coagulopathy. Right? So what is going on? So whenever vascular hemotoxicity, it is causing destruction of the platelets, or they cause altered platelet function, or they cause conjunctive coagulopathy. What is conjunctive coagulopathy? It is causing activation of all clotting factors. Because of this, all the clotting factors are getting utilized. So all clotting factors utilized, so finally they leads to what is called as bleeding. So this is what is called a hemotoxicity. So what you can see in the blood reports and all, how will you identify? The first of all, platelet count will be low. You can identify that one. And also your conjunctive coagulopathy, so all the clotting factors are getting utilized. So your INR is elevated, right? And your fibrinogen is decreased. Okay, and APTT is also elevated, right? So these are the manifestations you can see in the hemotoxicity thing. So an important thing here is, so they also cause what is called as altered platelet function. So because of altered platelet function, what will happen is, there is more and more platelet aggregation that leads to what is called as thrombus formation. So always the snake bite patients are at risk of developing MI or CVA in the future life. Clear? So this is what is called as hemotoxicity. So in hemotoxicity, it can cause three types of manifestations. One is, they can cause thrombocytopenia by destroying the platelets, or they can alter the platelet function and lead them to more and more platelet aggregation and thrombus formation. So they're more at risk of MI and CVA. And sometimes they also cause conjunctive coagulopathy, where they activate clotting factors and they get utilization of clotting factors very rapidly. So they lead to what is called as bleeding. So when you're doing investigations, you can see low platelet count. Because of conjunctive coagulopathy, you can see elevated INR, elevated APTT, and also decreased fibrinogen. Right. So after this, one more toxicity they're doing is what is called as neurotoxicity. Right. So this neurotoxicity, what is it going on? So what is called as this venom contains what is called as toxin. This toxin can affect directly your nervous system also. Right. So this toxin can be two types. One is presynaptic toxin or postsynaptic toxin. So what is presynaptic and postsynaptic? There is a neuron is there is a muscle is there. So between a neuron and muscle, there is what is called a synapse. So presynaptic toxin, the toxin which acts before the synapse, and postsynaptic, the toxin which acts in the synapse. Right? So for example, you see, main example is presynaptic is your crate. Your crate snake is a presynaptic toxin, and a cobra will produce what is called as postsynaptic toxin. Right? So both of these things, they produce what is called as descending paralysis. Whatever is presynaptic or postsynaptic, they produce what is called as descending paralysis. Very important. So the paralysis starts from above, from the ptosis. Then after that, there is a weakness of the jaw, then intercostal muscles, and slowly your limbs also get affected. That is called as descending paralysis. Right? So one important point you have to remember is presynaptic toxin means the toxin is present within the cell, within the neuron. But the postsynaptic means the toxin is present in the synapse. For example, if you see here, this is your neuron. This is your neuron. Okay, this is your muscle. Okay. Right. So the presynaptic toxin will act here. This is your presynaptic toxin will acting before the synapse. This is what is called a synapse. This is what is called muscle. Right. So the presynaptic toxin will act here. So always your presynaptic toxin is intracellular. This is your intracellular toxin. But postsynaptic is present in the synapse. So it is extracellular toxin. Right? So presynaptic is intracellular and postsynaptic is extracellular toxin. So why this point we have to know? Because when you are giving anti-snake venom, so because this postsynaptic is extracellular toxin, it will neutralize this toxin very fast. Right? So presynaptic toxin, once enters into the neuron, your anti-snake venom cannot enter into the neuron. So it is very difficult to neutralize this thing. So you have to immediately give the toxin for this. Immediately give the ASV for this. Right? So important inference point is, so this presynaptic toxin, it cannot be neutralized. Cannot be neutralized by ASV if delayed. But because it is postsynaptic extra, it is present in the synapse only, extracellular, it can be neutralized. It can be neutralized by ASV even delayed. That is the whole point you should know clinically. So neurotoxicity, the toxin is either presynaptic or postsynaptic. The toxin can act before the synapse or after the synapse. If before the synapse, it will enter into the neuron and causing effect, so it is intracellular toxin. If it is in the synapse, it is extracellular toxin. Because it is extracellular, it can be easily neutralized by anti-snake venom even if the treatment is delayed. But presynaptic toxin, it is intracellular, it cannot be neutralized by anti-snake venom. If it is delayed, you have to give early. Right? So both of these toxins produce what is called a descending paralysis, that is weakness proceeding from head to the toe. Right? An important thing is crate is the one which produces presynaptic toxin and cobra is the one which produces postsynaptic toxin. Clear neurotoxicity? Right. Let's go other thing, what is called as nephrotoxicity. We are discussing about nephrotoxicity. So what is nephrotoxicity? So some snakes, especially, they are also producing toxicity to the kidney. So mainly what snakes? Viper snakes. Mainly what snake? Russell viper snake. So Russell viper snake is most common in producing your nephrotoxicity also. So what are the mechanisms by which the kidneys are getting affected? Right? That is very important. What are the mechanisms by which kidneys are getting affected? The first mechanism is, as we discussed, they are causing what is called as damage to endothelium. There is always what is called as capillary leak. So because of what is called as capillary leak, there is what is the third space loss. So therefore there is decreased perfusion to the kidneys. So it's called as decreased perfusion to kidneys. That is one mechanism. So finally leading to what is called as pre-renal AKI. Right. And the second mechanism, because there is always what is called as this microvessel damage. Whenever there is microvessel damage and also platelets are getting aggregated over there, they form what is called as thrombus. So because of thrombus and all, they cause obstruction to the flow of the renal blood to the kidneys. So that is what is called as microangiopathy. Very important, microangiopathy. So what is microangiopathy? Because of damage to the small vessels, there is clot forming and obstructing the flow to the kidney. That is called as microangiopathy, leading to what is called as finally TTP, thrombotic thrombocytopenic purpura. That is also one of the mechanisms of causing renal failure. Right. And third is some snakes are myotoxic. So because of myotoxic, more amount of myoglobin is getting released, and this myoglobin will get precipitate in the urine, forming myoglobinuria that cause what is called as acute tubular necrosis. One is myoglobinuria or rhabdomyolysis. Okay. And some snakes, they what is called as glomerulonephritis, also one of the mechanism producing AKI. And some snakes also produce what is called as acute interstitial nephritis. So these are the different mechanisms by which kidneys are getting involved in the snake bite. The first mechanism is a capillary leak. Because of the microvessel damage, there is always leakage of fluid from the intravascular to extravascular space. So there is decreased perfusion to the kidneys, leading to pre-renal AKI. First concept. Right. In the second concept, because there is damage to the vessels, there is always platelet aggregation and all, forming a thrombus and also decreasing perfusion to the kidneys, and all will lead to thrombotic thrombocytopenic purpura. There is also second mechanism. Right. And the third mechanism, in myotoxic snakes, they produce rhabdomyolysis, producing myoglobinuria, so leading to what is called as ATN, acute tubular necrosis. And fourth is glomerulonephritis, and fifth is your acute interstitial nephritis. Right. So this is the pathophysiology of snake bite. It is producing different toxins, and some snakes also produce what is called as cardiotoxicity, which is very rare. Right. So let us revise what is pathophysiology once, then we will go to other things. So when you see the pathophysiology, it is seen with the wet bites. Wet bite means venom is present in the body. Whenever venom is present in the body, it can produce number of side effects. One is cytotoxicity, nephrotoxicity, neurotoxicity, myotoxicity, and cardiotoxicity. In cytotoxicity, whenever venom enters into the body, venom has multiple enzymes, and all these enzymes are metalloproteinase, hyaluronidase, collagenase, proteinase, and phospholipase. And all these enzymes together, they cause what is called local tissue destruction and lead to venom spreading. They also call microvessel damage, then leads to what's called capillary leak and producing edema, and finally lead to skeletal muscle necrosis and skin necrosis. So this is the spectrum on the cytotoxicity. The only thing you have to remember here is, whenever the patient comes with swelling or anything, there is no role of antibiotics until there is some necrosis, and there is no role of doing fasciotomy until there is necrosis. Right. The second thing is vasculotoxicity or hemotoxicity. So what is it doing to the blood system? The mainly it causes destruction of platelets, producing thrombocytopenia, or they alter the function of the platelets, leading to platelet aggregation and thrombus. So there are more risk of MI and CVA. And also they cause what is called as conjunctive coagulopathy, activating the clotting factors that leads to what is called as more and more utilization of the clotting factors, leading to DIC type of picture. So what you can see in the investigations, you can see what is called as platelet count decrease, or iron are elevated, APTT elevated, or fibrinogen decreased levels. Right. Then neurotoxicity. In the neurotoxicity, we are discussing there are two types of toxins. One is presynaptic and postsynaptic. The presynaptic is acting before the synapse, postsynaptic acting in the synapse. Right. The important thing here is the presynaptic toxin will be intracellular and postsynaptic toxin will be extracellular. So in this point, what is the important thing is the anti-snake venom can neutralize easily extracellular toxin. Anti-snake venom cannot neutralize easily intracellular toxin. Example is crate is the intracellular and this cobra is the postsynaptic or extracellular toxin. Right. And then nephrotoxicity. In the nephrotoxicity, vipers most common, Russell's viper. They cause 5 mechanisms. One is capillary leak, leading to what is called pre-renal AKI, or your microangiopathy leading to TTP, renal AKI, or myoglobinuria and rhabdomyolysis, or they can produce glomerulonephritis, or they cause acute interstitial nephritis. So any of the cause can be leading to nephrotoxicity. And some snakes are very rare, they can cause cardiotoxicity even. Right. So after this is known, just let us see clinically this one gets snake. Different types of snake bites. We already discussed Elapidae, Viperidae. Right. In the Elapidae, we discussed already cobra and crate. And Viperidae, we discussed already viper, Russell's viper, and saw scale viper. Right, this is already discussed. So important point why I made this chart is very important here. This is only very important clinically. Just listen to it. So we already discussed what is called as cytotoxicity. The pathophysiology of venom is cytotoxicity. This cytotoxicity can be seen with cobra, can be seen with Russell's viper, can be seen with soft scale viper, can never be seen with the crate. Very, very important thing. So all the snakes are producing cytotoxicity except the crate. Right? What is cytotoxicity? The tissue destruction or skeletal muscle necrosis, skin necrosis, leading to swelling and edema, and also cellulitis like picture. And all these things can be seen with 3 types of snakes, but you cannot see with the crate. Crate never produces cytotoxicity. Right? Right. Second, neurotoxicity. So this neurotoxicity is produced by the cobra and crate and never by the vipers. So these are neurotoxic snakes or Elapidae snakes. Right? Then vasculotoxic or hemotoxic. Vasculotoxic. So vasculotoxic snakes are produced with a viper and also soft scale viper, but never with your cobra and crate. Right? And last is your nephrotoxic. Very, very important. I already discussed. Nephrotoxic is seen only with the viper, Russell's viper, and nothing with the cobra's crate and never with the soft scale viper. Right? Very, very important table in the clinical. This is the only thing you have to see based on the snake. When a person has bitten a snake bite, when he brings the snake picture and all, try to identify what type of snake it is, and based on this you can see, oh, maybe this is a manifestation, this is a manifestation content, these are the tests we have to do. For these things we have to identify. Very important thing. Clear? So cytotoxic, all the snakes are producing cytotoxic except crate. And neurotoxic, your cobra and crate are neurotoxic, and viperidae are not neurotoxic. Vasculotoxic, your vipers are vasculotoxic, your cobra crate are not vasculotoxic. Nephrotoxic, your vipers are nephrotoxic. Right? Right. So broadly, clinically, what we can see is whether it is a neurotoxic snake or vasculotoxic snake. Right? In the neurotoxic are mainly Elapidae, that is cobra and crate, and vasculotoxic are mainly viperidae, that is Russell's viper or soft scale viper. Clear? Right. So when you take the neurotoxic snake bites, so how patient will present is usually after the bite, patient will have local reactions. That what is the local reactions? That is pain will be there, swelling will be there, cellulitis like picture, but never in the crate. So local reactions in cobra bite, but not in crate. Very important. Okay. After this thing, the venom is spreading. Then venom spreading, what's called? It is produced descending paralysis. We discussed already. The venom will produce descending paralysis. So what is this descending paralysis? So first of all, first involved is your ptosis. Very important. Right? And second thing is, whenever it's causing this thing, there is impairment of your jaw muscles also, neurotoxic. There is impairment jaw muscles, so therefore they're unable to close also, and risk of aspiration is also more. Right? And third, descending paralysis, they'll infect what is called as intercostal muscles. That's why they'll cause what is called as paradoxical respiration. Right? Finally, diaphragm also involved in patient will end up into respiratory failure and death. There is a descending paralysis. Right? So two important points. So whenever there is any neurotoxic snake bites, there is first local reaction. After that, there is some descending paralysis. But in the case of crate, there is no local reaction. So an important golden point in the case of crate is the crate, they are nocturnal snakes. Nocturnal snakes means they're active in the night time. So actually what is this thing, this rural population and all, they just sleep, they just, the shelves will be there. So what they all these nocturnal snakes, they always lie in the shelves. Right? So they're always lying in the shelves. In the morning time and all, they're very quiet. Nothing is there. In the night when everyone people are sleeping, then they become active. Suddenly they're moving over the shelves. Right? And suddenly they'll fall from the shelves onto the bed, and then they cause bite. Right? Usually their bites are not on the limbs. Usually their bites are suddenly over some abdomen or some the back or something, and the patient suddenly develops this descending paralysis. There is no local reaction also to identify some snake bite. Right? So that is why they are usually stroke mimic. So patient comes with sudden onset of weakness in the night. Okay, so sudden onset quadriparesis, sudden onset paraparesis or something, and they suddenly come to you in the morning itself, in the morning. So instead of thinking stroke and organic cause, just keep it in mind. Some maybe the crate bite also if patient is coming from rural areas. Right? It's a nocturnal snake which is active in the night, and actually its bite is not typically present over the legs. It usually present over the back or something, and its bite don't have any local reaction, directly descending paralysis. So patient will come to you descending paralysis. Maybe patient cannot even recognize what is bitten also, and there is no history of bitten or something. Just careful examination and watchful doubt, you can elicit your creates snake bites. Right. Now, if you see viperide, how vasculotoxic snake bites people present. Whenever there is snake bite, there definitely what is called as local reactions. That is your cytotoxic manifestation is present. That edema is there, right? And also skeletal muscle necrosis, skin necrosis can develop. So after this, what is going to happen is they leads to what is called as vasculotoxic. So there is always a bleeding manifestation. So what are the bleeding manifestations? Can be subconjunctival hemorrhage from the epistaxis. So anywhere the bleeding manifestations are very much more common here. Patient will come with bleeding manifestations. Right. And third, suddenly patients will come. These all external bleeding, the subconjunctival hemorrhage, epistaxis, all are external hemorrhage, but there is some internal hemorrhage also. So that we cannot identify. The only thing is based on patient symptoms. If patient is having abdominal pain, please rule out retroperitoneal bleed. Okay. If patient is altered sensorium, rule out intracranial bleed, intracranial hemorrhage. Clear? If patient is having back pain or abdominal pain or anything altered sensorium, please rule out intracranial hemorrhage and please rule out retroperitoneal bleed, and also please rule out GI bleed also. Right? So this is the thing. Right? So clinically there are neurotoxic and vasculotoxic. Neurotoxic are elapidae, vasculotoxic are viperidae. If there is a neurotoxic snake bite, there is one small local reaction after the descending paralysis. So descending paralysis, ptosis, then aspiration, then intercostal muscle weakness, and also diaphragm weakness. Right? But great, it's a nocturnal. Usually there is no local reaction. They only come with the paralysis. Just have a high suspicion. Right? If it's a viperidae bite, there is a local reaction, very huge local reaction, like completely cytotoxicity, edema, cellulitis, necrosis also. Then they'll have bleeding manifestations. One is external bleeding, subconjunctival hemorrhage, epistaxis, bleeding mucosal gums and all. And then they have internal bleeding also, accompanying abdominal pain to have GI bleed, and also back pain, retroperitoneal bleed, and also altered sensorium, they have intracranial hemorrhage. So just rule out all these things. Right? After knowing that thing, okay, patient has come to you. So patient has said he has a snake bite and all. He has shown you the snake picture. Then you identified, based upon the snake picture, you identified the thing. Then you are seeing maybe it's a vasculotoxic or neurotoxic. You are seeing for the manifestations. Now how will you treat the patient?